Choruję na CVID, czyli
I have CVID, that is, Common Variable Immunodeficiency. The correct diagnosis came relatively recently as I was diagnosed as an adult patient. However, I had health problems in early childhood. First, as a baby, I had many infections, respiratory tract infections, but they never ended in a hospital visit. So according to the physicians, it wasn't so serious to consider primary immunodeficiency. Then for many years I had a calm period. That returned when I was a teenager. Yet again, respiratory tract infections, pneumonia, ear inflammation, throat inflammation, and so on. All of this reached a real critical point when I was an adult and started work, and the problems occurred more and more often. It was more and more difficult to cure them. These were record-breaking fevers over 40 degrees centigrade, when in fact I wasn't able to go to the clinic to see my doctor. Besides, one antibiotic therapy wasn't effective, so I needed another one and another one. Often they included 3 antibiotics in the series. This made me think that there was something wrong with my immunity, that there was something bad going on in my body, which was difficult to identify by my physician. It was difficult for me to find immunologists in my town and my province. First, I landed in a private surgery run by an immunologist who ordered many quite costly tests, distinct for immunology. After I had the test, the doctor suggested that it was most likely this disease, and it required immunoglobulin administration, so I had to go to the immunology clinic as soon as possible to have further funding. When I went to the immunology clinic in Gdańsk, the doctor there confirmed that the earlier theory that it was CVID. Then I received the first intravenous infusion, and I've been treated since then. Apart from immunological care, I'm supervised by a pulmonologist, since there have been many lesions in my lungs. It's controlled every year. Due to this, I go to the hospital every year. I have many unpleasant tests such as bronchoscopy or videotheracoscopy, like I did some 6 months ago. That is, open lung biopsy. Besides, there is a gastrologist, as I've developed many stomach problems. Thus, such care is necessary because I undergo frequent antibiotic therapies for this reason. Recently, this has included hepatologists due to liver lesions, which have been controlled systematically at least once every 6 months, so that we can see what's going on there. Every Friday I give myself subcutaneous infusions, and every Friday this involves anxiety over the possibility of any allergic reaction, anaphylactic shock to occur. Whether I inject myself properly and the injection won't hurt. Moreover, it involves constant hospital visits, constant follow-ups, constant calls to various doctors to make appointments, to arrange for hospital visits, so that my everyday life is in fact not disturbed by all of this. Initially, I got a few intravenous infusions, like 5 or 6 infusions. I quickly decided to convert to subcutaneous infusions, mainly due to the distance to the hospital, which is over 100 kilometers to one, and the other over 200 kilometers. It's quite a distance, and I had some problems with constant trips. In addition, it's so much more comfortable that I take the drug at home. I go to hospital once every 3 months and not once every 3 weeks. So it's an additional bonus. Of course, as I said earlier, there's anxiety over the injections, but not only the subcutaneous ones, but the intravenous ones as well. Because my veins are damaged, so there's some concern with every injection and whether another vein will collapse. I won't be
nie
able to
trzaśnie
take the
się
drug.
coś I nie będzie mógł zostać lek podany po prostu. Także
Thus,
zdecydowanie
the subcutaneous
podawanie
administration is more
podskórne jest
beneficial for me
korzystniejsze
and
dla mnie,
my
dla
health.
zdrowia. Generalnie staram
Generally, I
się
try to live a
żyć w
more or
miarę
less
normalnie,
normal
chociaż uważam,
life.
że
Although I think that after the diagnosis,
psychicznie
initially I
na
felt
początku
low,
był taki
but the
dołek.
physical side has improved
Fizycznie
because
widać, że jest
intravenous
poprawa,
or subcutaneous
bo
infusions
wlewy
are
dożylne
effective.
przewodskórne działają.
Although there's some
Aczkolwiek,
barrier which
jest
makes
pewna
my
bariera,
everyday
która
life different
sprawia, że
than
ta
for other
codzienność nie
people.
jest taka jak u innych ludzi. Na początku
At first I thought that something horrible happened to me, that there was an incurable disease which had already wreaked havoc in my body, and that it could only be worse. When the doctor told me how the therapy looked, that there was a treatment, that I could help myself somehow, and then over time I've managed to feel better, but I think about it all the time. I can't stop thinking about it. I know I'm seriously ill and have to get constant medical care. We have to battle, try to live a normal life, but not to forget the follow-ups, therapies are part of our life.